From the KBIA Newsroom in Columbia, I'm Finnegan Bello. Affordable Care Act open enrollment started on November 1st. However, due to a congressional deadlock, enhanced subsidies for ACA premiums haven't been approved for 2026. KBIA's Ethan Davis has more on the consequences for Missourians.
Sheldon Weisgrau is the Vice President for Health Policy and Advocacy at the Missouri Foundation for Health, which is a financial supporter of KBIA. Weisgrau says Missourians are having to choose to continue buying health insurance at a higher cost or to purchase other necessities.
So if you're on a fixed budget every month and now your health insurance costs are going up, you might have less to spend on food, or you might have less to spend on school supplies or anything else that you might be using your money for.
The Kaiser Family Foundation estimates that if the subsidies aren't extended, the number of uninsured Missourians could increase by a fourth to more than 500,000 people. I'm Ethan Davis, KBIA News.
And net farm income in Missouri is expected to increase this year and exceed forecasted gains. According to a report from the Rural and Farm Finance Policy Analysis Center, this year's net income is expected to be 58% greater than 2024's net income, due to an increase in livestock receipts and government payments. Missouri Business Alert reports livestock receipts were the driving factor behind the elevated income expectations. Missouri leaders applied Wednesday for a share of $50 billion in federal funding aimed at helping keep rural hospitals open. Sarah Fenton reports from St. Louis the Rural Health Transformation Program was created under the One Big Beautiful Bill Act.
Legislators wrote the fund into the spending bill after critics raised alarms cuts to Medicaid could be catastrophic for struggling rural hospitals. The program allows states to submit plans to the federal government for how they would use the funds. Missouri's proposal calls for creating a regional network of pharmacies, providers, and public health agencies. The state would also improve telehealth services. If approved, the program could send approximately $200 to $250 million to the state annually over the program's 5-year span, according to estimates from the Missouri Department of Social Services. Governor Mike Kehoe said in a letter accompanying the application he would support a new law to expand the scope of practice for physician assistants, dental hygienists, and other providers. I'm Sarah Fenton, St. Louis Public Radio.
And Columbia Public Schools ranked in the top 15% of Missouri districts in the latest state performance report. The district reported improvements in every content area of the Missouri Assessment Program, including a 3.1% increase in math and a 3.6% increase in science proficiency. The Columbia Missourian reports attendance also continues to be an area of focus for the district. For the second consecutive year, 80% of students attended school at least 90% of the time, an improvement over past years, but still shy of the state's attendance goals. I'm Finnegan Bello, KBIA News.